Now, what if you see your provider Monday morning, and he or she does an exam, and you have 10 tender points? Does she or he say, go home and come back when you have 11? You don't really need 11 tender points. You need it for an academic paper. But if you have aching and pain all over and 8 tender points, that qualifies. So if someone tries to tell you you couldn't have fibromyalgia, you have 9.5 tender points, let them know that you really do have that. There are designated tender points, as you can see. But what if you have pain everywhere outside the tender points? Does that disqualify for you from having a diagnosis of fibromyalgia? It absolutely does not, and that's been addressed. So if someone says you have pain all over, you couldn't have fibromyalgia, that's not correct. That having pain outside the designated tender points does not negate a diagnosis of fibromyalgia. In the same way that having fewer than 11 doesn't negate that. All of you know tremendous amount of fatigue, perhaps from a sleep disorder, perhaps from pain, perhaps from medications, but also perhaps because you do have fibromyalgia. Non-restorative sleep. If you're asked the question, do you sleep well? Many of you might say, I sleep fine. So the follow-up question is, are you refreshed when you wake up? And in one survey, 100% of patients with fibromyalgia said they were not refreshed, even though 25% felt they slept appropriately and proper. Stiffness on awaking. There can be so much stiffness and even swelling of the fingers that this can be confused with rheumatoid arthritis. And sometimes patients with fibromyalgia are misdiagnosed and actually thought to have rheumatoid arthritis. So you actually can get swelling of the fingers. Initially, when you look at the first couple of papers, it was a swelling feeling. There actually is swelling. There also, as you know, is a lot of numbness and tingling. But again, carpal tunnel syndrome is overlooked in the majority of fibromyalgia patients who have it, just because numbness and tingling are a component of fibromyalgia. So what if you do? Let's say you're referred to a neurologist. Do you tell the neurologist you also have fibromyalgia? Well, I think it depends on you and it depends on the neurologist. Sometimes I'll tell patients of mine when I refer them that this is definitely not your fibromyalgia. And if you don't feel you have to tell them you have fibromyalgia, don't. Because often if you tell someone you have fibromyalgia, they'll say, well, what do you expect? That's your knee pain. That's your headache. That's your trouble swallowing. That's the swelling. So I'll often instruct patients, if they don't feel they have to do this ethically, that's not why I'm referring them. I'm referring to know exactly what is going on, and I don't believe it's fibromyalgia. Cognitive difficulties. Impaired memory, concentration, could be sleep, could be fatigue, could be severe pain, and usually cognitive problems improve significantly when you're treating the pain, sleep, fatigue, but it also could be part of the fibromyalgia. If you really have severe cognitive problems, then I would recommend you see a neurologist, but a good one who will take you seriously and do a good workup, including an MRI scan of the brain if you need it. So certainly, all of us have cognitive problems from time to time, but if you feel like your cognitive problems outweigh all the other problems you're having, then I do think you need an evaluation, again with the idea that, yes, it occurs in fibromyalgia, yes, it occurs in chronic fatigue. Does that mean that your cognitive problems are definitely due to fibromyalgia? Maybe not. Cause of sleep disturbance, there are really multiple causes of sleep disturbance. If you look at associated conditions, irritable bowel, irritable bladder. Some people have found that pregabalin or Lyrica helps irritable bladder quite a bit. Anxiety, depression. In most studies, most published studies, there's no evidence that fibromyalgia comes from depression. It doesn't come from psychiatric conditions, but from 25 to 50% of patients with any chronic illness have associated depression. This was first recognized by Dr. Rick Rees, who's a psychiatrist at the University of Washington, and he ended up having patients with rheumatoid arthritis fill out questionnaires, and 25 to 50% of them were severely depressed because of chronic illness. So don't let anyone tell you that this is a psychiatric condition, because all of the studies to date have demonstrated that it's not a psychiatric condition, but it's a condition because of the chronic pain, fatigue, cognitive problems, changes in quality of life, can certainly cause depression in many patients with fibromyalgia and or chronic fatigue. Headaches or migraines. Again, if you've got severe migraines, you really need to get them treated. You'll feel much better. Paresthesias or tingling. Make sure you don't have a neuropathy, neuritis. Make sure you don't have carpal tunnel syndrome. Very, very common. Very commonly overlooked in patients with fibromyalgia because tingling is a part of fibromyalgia. TMD, really, now that Herb Gordon has retired, True Love at the university provides very good care for this, and often at affordable rates and sometimes with grants. Raynaud's syndrome, patients with fibromyalgia do have that kind of vasospastic, so their fingers do turn white in the cold or white with stress. Chronic fatigue syndrome is part of this. Lyme disease, some patients with fibromyalgia actually have Lyme disease. If you catch Lyme disease and you treat it early, you get rid of most of the symptoms. But by the time many patients end up having fibromyalgia, they've had Lyme disease for a long time. If you think you have Lyme disease, you can't miss the rash. It's called erythema chronica migraines, and it's a large red ring that expands. So you really can't, if you think you've been bitten by a tick and you wonder if it's Lyme disease, you will definitely see this rash quickly. Rheumatoid arthritis, lupus, Sjogren's. Again, because you have fibromyalgia doesn't mean you don't have something else also, and that you wouldn't feel much more comfortable treating that other thing. Yes?
Does Raynaud's also affect feet, or is that separate?
It does. Feet, earlobes, nose. So you can get it in any of those areas where the arteries are really small. Proposed etiology, there now is evidence that in part it's genetic. It's an autosomal dominant, yes?
Can you repeat the question so that...
Oh, yeah. Thank you. The question is about Raynaud's, can you get it in your feet? And the answer is yes. So there appears to be a gene, and that's really why we're seeing these family histories. That's not the only mechanism in which you can get fibromyalgia. There are definitely people who have fibromyalgia without that gene, but there appears to be a genetic component. Environmental factors that may trigger the onset, physical trauma or injury. There's now excellent evidence for the triggering of fibromyalgia after trauma such as a car accident, particularly when there's a whiplash present. If you actually were to do a literature search and you looked at neck injuries and chronic pain with or without fibromyalgia, you would get exhausted even just compiling the number of papers. So the neck appears to produce some sensitivity and vulnerability. So there are a number of really good studies that demonstrate that patients can get fibromyalgia after trauma, particularly after neck injuries, whiplash. One of the ongoing studies is being done at the University of Washington Pain Clinic, Jim Robinson and colleagues. So there's some excellent data on that. Infections, hepatitis C. So when your provider sees you, diagnoses fibromyalgia, one of the things he or she should be doing is making sure you don't have hep C. Lyme disease, pretty rare out here. If you were in Connecticut, you'd all be tested for Lyme disease. But again, it's pretty tough to miss the rash. And then patients with HIV. That infection also can get fibromyalgia. But it also may occur concurrently with several other diseases, including autoimmune diseases. And how do you know that? Well, you know that in part by lab. But you also know that by taking a careful history. For example, if someone with fibromyalgia says to me, I have asthma, and every time I'm given this steroid pack, I feel 100% better.